In what passes for high drama in the building behind me, Senate Republicans had to pull their health care bill, as you know, because they didn't have the votes. This was a train wreck in slow motion that everyone could see coming. Now, it's possible this bill will be revived. We went through the near-death experience in the House, but it's very, very difficult, and Mitch McConnell had set a July 4th deadline precisely because he wanted to focus everyone's attention on rounding up those 50 votes that he needs before the recess, before the opposition gathered even more strength, but it didn't work out. And it's almost like trying to square a circle, because how you tinker with this bill, and President Trump has indicated that he will continue to try to come up with some kind of compromise. That's why he invited all the Republican senators to the White House late yesterday. It is hard to avoid making one group or another group happy. If you make the bill a little more generous, give it a little more heart, as the president says, well, then conservatives think it costs too much, it's too much like Obamacare, too much government intrusion on people's lives and on their medical decisions. And if you make the bill more stringent, you get a welcome cheer from the conservatives, but the moderates, who have more influence in the Senate than they do in the House, say, you know, we're not going to pass a bill and then go into 2018 watching millions of people lose their coverage. Now, I'll have to hasten to add that even with that CBO estimate of 22 million people losing it over a decade, 15 million next year, some of those people will just be opting out of the system because you don't have an individual mandate anymore. But still, slowing the extension of Medicaid, premiums rising, particularly for older people. I mean, this is a tough pill to swallow for any group of lawmakers, and that's why this has been so very difficult. I don't even calling it repealing and replacing Obamacare anymore. They're trying to revamp Obamacare with some kind of shaky compromise. And so, you know, the plain fact is nobody likes this bill. Nobody loves it. Nobody's enthusiastic about it. The Democrats are doing everything they can to stop it. Republicans wish the thing would just go away, but they've promised for 7 years to do something about health care, so they feel like they can't come up empty-handed. The more you get into these, you know, jerry-built compromises, the more the thing is complicated and hard to explain and hard to sell. Now, they still could pull it out for this reason. You know, I never underestimate the ability of Congress to come up with some paper-over compromise where, you know, we promise to have a study commission report back in 6 months, and a year from now, if this happens, we'll do this, and if that happens, and the individual states can do this, that, and the other thing. You know, it becomes more and more and more complicated, but then everybody can say, well, I improved it a little bit, and you get over that 50 mark. But you had some Republican senators who didn't even want to vote to let this thing come to a vote on the procedural motion, and that's when Mitch McConnell knew he had to regroup, delaying the vote. Who knows how long it will be delayed, but healthcare is a very, very complicated thing. Both parties know that. It's particularly hard to pass with one party's votes. The Democrats managed to do it with strong-arm tactics in 2010. Republicans are trying to do it now, but this is a difficult Rubik's Cube, and it became more difficult yesterday.